This is Ethan Moore. I'm going to be performing my bed bath technique. First, you would place a bath blanket over the patient while the sheets are still on them. Sheet in the bedspread is still on them. Then you would start at the top and roll the bed linens, the sheet and the bedspread all the way down to the end of the bed. Then, to begin bathing, you would have two basins, one for washing and one for rinsing. You would fold the washcloth in a mitt over your hand. And then you would begin washing the eyes from the inner canthus to the outer canthus. Then you would do forehead, cheeks, nose, mouth, ears, and neck. Then to do you move on to the arms. Be sure not to fold the bath blanket any further than the perineal area. You place a towel under the patient's arm. And then with long, firm strokes, you would wash from the fingertips to the shoulder on both sides with long, firm strokes. From the fingertips up to the shoulder, back down, back up, on both sides. And then you would apply deodorant. Then you would remove the towel from the patient's arm. You would wash their chest and abdomen, again, with the mitt on your hand. Long, firm strokes from bottom to top. And then you would wash the inguinal area. Wash, dry, and rinse. Then you would cover the patient back up over the chest. And then expose the legs. Again, be careful not to fold the bath blanket any further than than the thighs. You would place the towel under the patient's leg. And then start washing from ankle to knee, and then knee to thigh. Ankle to knee, long firm strokes, and then knee to thigh. On both sides. And then you would wash the patient's feet, and then between their toes. Now to discuss hygiene of the perineal areas. For a man, you would first of all drape him as appropriately as possible to ensure the most amount of privacy, male and female. And then you would expose the patient. You would begin washing the penis from the tip outward in a circular motion. Then you would wash down from the tip to the base, and then wash the scrotal areas. But all of that is after, the first thing you should do is wash the upper thighs and inguinal area. Then you move to the tip of the penis, wash in a circular motion from inward to outward, and then wash the shaft from the top to the bottom, from the top to the base. And then you would wash the scrotum and all of the skin surrounding it and under it. Then for the vagina, you would wash, or for a female patient to wash the vagina, you would wash the um, external labia and labia majora first, cleaning from top to bottom, and then you would expose the urethral and vaginal openings with 2 fingers to spread it apart. Then again, you would wash from top to bottom the labia minora and the inside of the vagina from, again, top to bottom. Then you would move to the buttocks area. You would turn the patient on their left side. You would wash the buttocks from the outer to the inner, and then you would help the patient back into a comfortable position in bed. Now for oral care, you would first determine if the patient could do it themselves, and if they could, then you would either help them into the Fowler's or semi-Fowler's position, or help them to the side of the bed. As the patient is brushing their teeth, observe their technique and do any teaching that might need to be done. Then after they're done brushing, tell them to take several sips of water and then spit it into a basin. Then you would instruct the patient to start flossing, and again, observe their technique. If they have it right, then no problem, and if there is something you could teach, then teach it. Again, have the patient rinse their mouth out with water and spit into a basin. And then finally, tell the patient to rinse their mouth with mouthwash for at least 30 seconds. And then also spit that into a basin. After they were done, you'd place their toothbrush, toothpaste, the basin, and all their personal belongings in a safe place for reuse. Then for denture care, you would obviously put on clean gloves. You would use a gauze pad with your thumb and your index finger to remove the top denture and slightly rotate it to take it out. And then you would use your thumb to push up against the gum line on the bottom denture and place it in a denture container. Then you would take both top and bottom denture to the sink, place a washcloth in the sink in case you were to drop it and there would be any breakage to prevent that. Then you brush all surfaces of the dentures, the biting surface, the palate, top, bottom, all around, and then rinse them thoroughly. Then apply adhesive for the patient, and then put the top one in first and the bottom one in last. After you inspect to be sure that the patient's gums and mouth don't have any sores or breaks in the skin, cuts, anything like that. Then you would instruct the patient to rinse their mouth with mouthwash again for 30 seconds. And then you would place all their personal items for safe use somewhere else. You would place them somewhere else for safe use later on. And then for I think that's it. Oh no, if you were bathing a female patient, then you would be sure to lift the breast with the back of your hand and wash properly, and be sure that underneath the breast was washed and dried.